Hello, this is Dr. Shilpi Reddy, Head of the Department, KIMS Cuddles, Mother and Child Center, Kondapur, Hyderabad. Today we'll talk about fibroids. What are fibroids? Fibroids are smooth muscle cell tumors which are present inside the uterus. Uterus is a bag of smooth muscle cells. So when these smooth muscle cells together form a cluster of smooth muscle cells in a whorled appearance, those are called fibroids. Fibroids can be of different types depending on their location, depending on the size, depending on the severity. So fibroids are tentatively, they are non-malignant. Most of the fibroids, more than 99.9%, are non-malignant, non-cancerous in nature. Very rarely there is a cancer changing that is happening, that happens even in fibroids, and it can cause malignancy. But usually fibroids are non-malignant and they are a cluster of smooth muscle cells of the myometrium, that is the uterine muscle. So fibroids, depending on their location and severity, are categorized. Symptoms of fibroids can be plenty, and more so if you have to talk, some fibroids are just asymptomatic. There are no symptoms of fibroids which are located even up to a very large extent, very silent they appear. Only during the routine examinations that women go for, like a pelvic examination or an ultrasound or some other reason that they go to the hospital and they get an ultrasound done and incidentally find fibroids. So fibroids can be asymptomatic. Well, the symptoms of fibroid and the fibroids which are symptomatic can be, they can present with symptoms of overbleeding, which can be severe bleeding with clots and heavy flow. They can have pressure symptoms like pain abdomen. They can have symptoms of congestion like severe pain during periods. They can have symptoms of pressure when large cervical fibroids are there, large broad ligament fibroids are there. They obstruct the passage of urine and cause urinary pressure and renal pain also backwards. So they can be asymptomatic to causing overbleeding, to causing severe pain, to causing pain during intercourse, to causing pressure symptoms and space occupying distension of abdomen and heaviness. So all these symptoms are fibroid related. They can have symptoms of infertility also, difficulty in conceiving, recurrent pregnancy loss. For some fibroids which are inside the cavity of the uterus, they tend to disrupt pregnancies. They tend to cause miscarriages. They tend to cause preterm deliveries. These can be one of the presenting symptoms of those fibroids. So fibroids can be silent. They can always have symptoms. So it does not mean that suddenly there was a scan done and you had fibroids, and you cannot deny the presence of fibroids because they can be asymptomatic. And depending on the location of fibroids, the symptoms can be there. Pressure symptoms can be because of large fibroids which are there towards the outside of the uterus. Pain and pain during period symptoms can be because of the fibroids which are inside the muscle of the uterus, and high bleeding and clots can be because of the fibroids which are there inside the uterus cavity. Risk factors of fibroids can be, as said, the first risk factor can be genetic. Yes, familial also. There are people who have had fibroids in their family. One is the genetic factors. The second factor can be estrogen. So unopposed estrogen, that means longer cycles, late marriages and late pregnancies can be one of the reasons for long estrogen cycles and development of fibroids. And fibroids do have a tendency to increase in size depending on the state that they are and the location they are. So the reason for fibroids can be genetic, can be, they can originate all by themselves, but usually estrogen is one of the major factor behind the development of fibroids. Fibroids are usually diagnosed with the symptoms that they have given. So once people come with overbleeding or pain or distension of abdomen or pressure symptoms or urinary blockage or any of these symptoms, we generally do a pelvic examination. So when we do a pelvic examination, the size of the uterus seems to be bigger than the normal. That is the first clinical sign and symptom that we even see during our examination in the OPD. So when you feel that the uterus size is bigger, and the patients are passing a lot of clots and all that, you advise an ultrasound. So basic transvaginal ultrasound examination can give you the presence of fibroids, the size of fibroids, the location of fibroids, and its correlation to the symptoms and signs the patient is complaining of. So ultrasound examination can be very clearly, you can map the fibroids. If the fibroids are large in size and they are masked and they are multiple entity, they can definitely be diagnosed with an MRI pelvis or a CT scan pelvis. So very clearly you can know the size, shape and the 360-degree appearance of the location and abutting structures next to the fibroids. Depending on the location of fibroids, there are different treatment options. If the fibroid is small in size and that is not causing any problem, or there is no clinical symptoms and sign, the patient is asymptomatic, they can just follow up for the next 6 months or a year to check the size in fibroids, whether it is growing or not. Usually fibroids are silent in nature, they do not cause much harm. They are present at unidentified locations, and they have a very less value in terms of treatment. But yes, people with overbleeding, people with pain, severe pain, people with pressure symptoms, people with larger fibroids and fertility issues and miscarriages definitely have to go through some therapy. So therapies can be generally categorized into surgical and non-surgical options. So whom do we choose for the surgical options and whom do we choose for non-surgical options? Surgical options are chosen when the fibroid is causing miscarriages, when the fibroid is inside the cavity of the uterus or inside the muscle of the uterus and is causing severe pain, severe bleeding, and those are the reason that if that is the reason identified for any miscarriage, or they are planning pregnancy or fertility is their choice of treatment, then yes, they can go for surgical options. For medical options, you can have people with perimenopausal age group who are not conscious for their fertility reasons. They can experiment on drugs which have a longer acting potential and these things. So anybody symptomatic, you can give them surgical options. Anybody asymptomatic and not going for any surgical, not willing for surgery or not contemplating fertility as their primary choice, they can be subjected to medical methods. There are some people who contemplate medical methods and medical treatments even for fertility when they are refused for surgeries, or there are dual approaches when we give medicines in the form of injectable GnRH and in the form of medications so that the fibroid shrinks in size, then we check in for a surgical option and then give them clearance. And post-surgery also, if they have any other problems like endometriosis and all, we give further medication that is needed. So it can be a sandwich therapy, medication, surgery and medication, or it can be only surgery by giving them 100% clearance. In surgical options, we have minimal invasive surgical options like hysteroscopic guided endometrium, submucosal polyps and submucosal fibroids which can be resected through the resectoscope. We have laparoscopic approaches for myomectomy. There are open surgeries and there are laparoscopic surgeries depending on the availability of the facility and the expertise. We usually advise them the particular kind of surgery. But for myomectomies, always a laparoscopic surgery gives minimal invasive procedure with good results, and the effective fertility rate can be regained as soon as possible. For any myomectomies which are done open methods for huge and large fibroids which are more than 30 weeks or 35 weeks of the size of the uterus, definitely contemplating open surgery is more easier and the healing takes its own time. And For perimenopausal age group and they are symptomatic, you can obviously give them option for surgery and also medications and therapies. There are non-surgical therapies like HIFU, wherein high intensity focus ultrasound therapy is also there. We have endometrial, the uterine artery embolization procedures are also there. There are medications like ulipristal medication is there, letrozole medication is there. There are time-tested medications like GnRH injections that are there. There are many drugs, but depending on the requirement, depending on the age, depending on the fertility status, the consultant takes their own choice. Depending on their choice, the treatment goes on. Wherein they have lot of doubts, some people have lot of doubts that my doctor has asked me for medication, the other doctor has asked me for surgery. So two different doctors will have two different views, and everybody would go to a common position of decreasing the symptoms as well as the fibroid. So whatever is required in the lifetime at that point of time gains importance in choosing the method of treatment. So if you have to talk about precautions, there are a lot of precautions that you need to look into. Regular gynecological examinations is mandatory. You cannot skip on a gynecological examination, and you're likely to find undiagnosed fibroids usually when you don't have examinations, when you just land into a clinic for some other problem and you find fibroids. So regular gynecological examinations is a good method of knowing your reproductive tract and their problems. And the role of unopposed estrogen is there. So early contemplating pregnancies and completion of families is very good. The second thing is, whenever you are delaying pregnancies, definitely you have to look into the aspect, and clinically the role of screening comes there. Anybody with a genetic background, have a look out for your fibroids and the uterus structure by a normal ultrasound on a regular basis. And if you have fibroids, do keep a check on them. It is very important that you need to check whether they are growing, whether they are silent, or whether they are regressing. And anybody who's pregnant, you should book yourself under a high-risk center where you will have somebody to help you with the fibroid monitoring and 24-hour care, just in case if you land with any pain or bleeding or any fibroid complicating pregnancy symptoms. So it is mandatory that anybody with fibroids and pregnancy should be booked under proper care. So prevention is definitely better than cure, and being alert and being in line with the screening modalities and screening methods keeps you well aware of your reproductive tract and its problems. The early the diagnosis, the very clear route that you will have for monitoring, and if there is any need of therapy, you will have wide range of options for treatment.